My name is Robert Bache, Medicare Bob. It's FAQ Friday, and in this video, I'm going to answer the question, what is a Medicare Advantage Plan? I'm going to give you my quick version of what it is, and then I'm going to have the actual publication from Medicare's website, medicare.gov, scrolling behind me, and I'll kind of go over some bullet points on that. So first, I'll tell you how I understand them. What you want to understand about a Medicare Advantage Plan is it is not a Medicare supplement. You will not be on Medicare and an Advantage Plan. Now, there's nothing wrong with an Advantage Plan, but what you have to understand is it's a private alternative to Medicare. So instead of your monthly premium that you're paying, most of you are paying it out of your Social Security check, the $134 a month, instead of that going to Medicare and then you having the red, white, and blue card, and Medicare essentially paying 80%, your $134 a month will now go to a private company instead, like Humana, United Healthcare, WellCare, Kaiser, lots of really good companies that offer the Advantage plans. So it's not a supplement. It's not going to work with Medicare. It's going to work instead of Medicare. Now, there's nothing wrong with that, okay? Because they get federal funding from the government to provide a benefit package. The whole idea behind the Advantage Plan is a private company, in theory, is going to run healthcare more effectively for the beneficiary than the government can. Now, this is not a political post, okay? But that's the idea behind the Advantage Plan. Medicare Advantage plans are also called Part C. Okay, what they do is they essentially combine your A, B, and most of the time your D benefit into one health plan. The easiest way to understand the benefits of an Advantage Plan is it's basically a lot like what you've had your whole life, like with group insurance or private health insurance. You're going to have a network of doctors. It's either going to be an HMO, meaning you can only go to certain doctors, or a PPO, meaning you have two groups of doctors you can go to, one in-network, one out-of-network. And then there's also a private fee-for-service, which is a doctor has the right to accept or not accept on a case-by-case basis. But the point is you're going to go to certain doctors, and you're going to have copays and out-of-pocket costs. You know, you might have a $25 copay for a primary care visit, a $50 for specialist, you know, maybe lab work's $150, maybe an MRI is $150. You know, if you get a knee replacement or cataract surgery, the plan might only pay 70% and you pay 30%, or maybe they have a copay for that outpatient procedure of $350. Medicare Advantage plans are not standardized throughout the country. So an Advantage plan is county zip code specific. So you have to look in your zip code to see what plans are available. So let's say your friend in Florida has a Humana Gold HMO that they're really happy with. And let's say you live in Dallas, Texas. And Dallas does have a Humana Gold plan. Well, those benefits are not the same. The network's not the same. They're going to be different based on where you live. There's nothing wrong with an Advantage plan, but the point is you're going to have out-of-pocket costs. What's nice is they do have a max out-of-pocket cost, a max out-of-pocket limit. The nation average right now is about $6,700. Now, in some states, it might be $3,000, some states it might be $10,000, but if you look across the board, most plans for 2018 and what I've seen so far for 2019 is going to have a max out-of-pocket of $6,700. So at least you have some type of safety net. Something that's really important that you want to understand about an Advantage plan. If you choose an Advantage plan and you later want to upgrade to a supplement, a true Medigap, one of those standardized plans like the F, the G, or the N, you can do so every year between October 15th and December 7th. However, you have to medically qualify to upgrade that. You're from an Advantage plan to a Medicare supplement. The only time you don't have to answer any health questions for most people is when they first turn 65 or first join Medicare Part B. So it's very important. If you choose an Advantage plan and then later you want to upgrade, you have to medically qualify. So you want to keep that in mind. Because some people say, you know, Bob, I'm 67, I go to the doctor maybe 4 times a year, I'm really healthy. I'll go with the lower premium Advantage plan, you know, because I don't think I'm going to meet those out-of-pocket limits. And that's okay. There's some people, about 15% of our clients, because we offer both Advantage and Medicare supplements, about 15% of our plans, or 15% of our clients choose an Advantage plan. There's nothing wrong with that. I just make it very clear to them that if you want to upgrade later, so let's say you go with that cheaper plan, and then something medically happens, so you reach that $7,000 out-of-pocket limit, okay? And then October comes around, so you call us and you say you want to upgrade. Well, you may not be able to. you're going to have to wait until you have a 2-year stability of health, which most Medigap carriers, supplement carriers, are going to require. So it's very important that if you choose an Advantage plan, you have to understand that to upgrade later to a supplement, you're going to have to medically qualify. So that's I think that's about 3.5 minutes or however long that was, my explanation, how I explain Medicare Advantage plans. But I also want to go ahead because the government has a publication that I'm going to have scrolling behind me. I'll kind of just touch base on how they explain Advantage plans. So that way you really truly understand what they are. So you're looking behind me, page 1 says, what is a Medicare Advantage plan? Here's how the government describes it. You can get your Medicare benefits through Original Medicare or a Medicare Advantage plan like an HMO or PPO. If you have Original Medicare, the government pays for Medicare benefits when you get them. Medicare Advantage plans, sometimes called Part C or MA plans, are offered by private companies approved by Medicare. Medicare pays these companies to cover your Medicare benefits. If you join a Medicare Advantage plan, the plan will provide all of your Medicare Part A hospital and Part B medical insurance coverage. This is different than a Medicare supplement Medigap policy, okay, which I have other videos on what is a Medigap, what is a Medicare supplement policy, so you can look at those. Here's what the government says. What do I need to know about Medicare Advantage plans? There are 3 different types of plans, which I essentially touch base. There are a few different types of plans. There's HMO. Again, you can only go to certain doctors. We've kind of heard that term before. PPO, where you can go in or out of network, but you still have a network of doctors. A PFFS, which is private fee for service. That means that a doctor on a case-by-case basis or hospital on a case-by-case basis can tell you beforehand if they will or will not accept your plan. And there's what's called a special needs plan. I also have videos on this. These are for 2 types of demographics. They're for this low income, dually eligible, which is somebody who has Medicaid and Medicare, or that's a DE plan, dual eligible, or there's also special need plans for medical conditions, heart attack, diabetes, stuff like that. Some plans in some areas have special plans. There's also called an HMO point of service. So you have a network of doctors, but then you also have the flexibility of going on a point by service basis, and they have this let you know if they will take or not take that plan. Okay. There's also Medicare savings account plans. These are very rare. Very few areas have those. That's more of a trial that the government's doing. Okay. When can you join a Medicare Advantage plan according to the government? It's when you first are eligible for Medicare or every year between October 15th and December 7th. You don't have to answer any health questions to get a supplement, or excuse me, to get an Advantage, except do you have end-stage renal disease? If you have that, you cannot get what most people can get with the Advantage plans or special plans designed for you. How much do Medicare Advantage plans cost? So again, the plans are not standardized, so this is going to be throughout the country. It's going to be different based on your zip code and your county. But these are those 0 premium plans you see advertised on TV every year from about September through January or February. Okay, so you're going to see them as 0 premium, 0 premium. Not all Advantage plans have a 0 premium, but again, even on the 0 premium plans, you still have to pay your $134 Part B premium. But instead of it going to Medicare, it's going to that company that you choose. But even though there are some 0 premium plans, we are seeing also plans that have, a $60 premium or $80 premium. So not all Advantage plans are 0 premium. But if you see the word 0 premium, all-in-one plan, Medicare complete plans, those are Medicare Advantage plans, not supplements. Okay, so that you want to know that. What does a Medicare Advantage plan cover? There's a big long paragraph here. I'll just tell you though. Essentially, the rule that the government regulates on Advantage plans are they have to be as good or better than with the Medicare benefits provided through Medicare A and B, okay, and Part D benefits if it offers that. All right, so that's something to think about. Okay. So those are the 2 pages that refer to Medicare Advantage plans. I have other videos on all Medicare topics. If you have a comment, please leave it below. I'll be glad to answer it. Please share this video. Please like this video. Please like our Facebook page so you can stay up to date. Also, please subscribe to our YouTube channel so you stay in the loop with Medicare. Have a great day, everyone.